On the Medical Watch, a potentially disturbing development regarding the spread of COVID-19.
Yeah, there's new research that raises concerns that the virus could be airborne. WGN medical reporter Dina Baer has more.
An airborne virus can spread long after an infected person leaves the area. It's a frightening scenario doctors know occurs with the measles. Now some scientists are suggesting the same is true for SARS-CoV-2, the virus that causes COVID-19. With the rapidly changing information on this novel virus, here's what we know right now.
Droplets from an infected person are carried through the air when someone coughs or sneezes. If another person inhales those virus-filled particles, they can get infected.
Droplets typically don't travel more than about 6 feet, and so if you come into contact with those respiratory droplets, particularly if those respiratory droplets that contain virus come into contact with your eyes, mouth, or nose, you can become infected.
That person-to-person spread is behind the wisdom for wearing masks when people are in contact with others, strangers or friends and family who could have no symptoms and still have the virus.
Masking in public is going to prevent infection regardless of the mode of transmission.
The New York Times reports 239 scientists in 32 countries are pointing to evidence the coronavirus can spread beyond person-to-person contact. They're reportedly poised to publish their findings about SARS-CoV-2 lingering in the air. The World Health Organization, however, disputes the evidence, calling it not convincing. So is SARS-CoV-2 airborne?
The virus can be transmitted by the airborne route. I think the difference is whether or not you consider that the predominant mode of transmission or a possible but less dominant mode of transmission.
Multiple tests have been conducted to show exactly how far the virus that causes COVID-19 is launched from people who are infected and contagious. In workspaces, those at nearby desks get sick in clusters, while those in private offices in the same building do not.
And I don't think airborne spread is the predominant mode of acquisition, but it certainly does contribute to some infections, and so I think we need to be aware of it. I think the difficulty becomes how you prevent it. If you only social distance without taking measures to prevent some of this airborne spread, then social distancing alone will be less effective. We know that with measles, for example, it'll just sort of spread and fill the room. And with COVID, we don't know. We do know that in some of these super spreading events where they've been able to identify where in the room the infected individual was and those who became infected, we've observed that airflow will spread from the area where air is being pushed into the room towards the return where air is being pulled out of the room. And so if you're in the path of that air current in a room with somebody who's ill, you may be at higher risk.
It also depends on the building itself. Hospitals, for example, have better airflow systems versus older bars and even churches. Doctors still say the best advice is to be safe and wear a mask. Back to you.